Cutting Edge Pain Relief, the channel that teaches you how to biohack your pain and get back to doing what you love.
Talked about doing this trial. After we did the eval, how much time took place between your eval and us doing this trial?
From the eval to the trial, it wasn't long at all. It went on. I think the longest part was getting the report from the psych eval to us actually getting that put in the trial, and then from the trial, it only took 2 weeks to get the permanent one.
Okay, so when we did the trial, before we jumped to the permanent piece, what happened with the trial?
The trial, I showed up at the hospital, and it wasn't long, probably about an hour, if that.
Yeah.
The trial, you had those little things put in and in place, the wires. And within getting back into the little room, it was on, turned on, and it was like heaven. Oh!
You just told me a little while or so ago, right, that you were concerned because this pain had been going on for 9 years. It was incredibly severe. Nothing worked for it. And then, you don't think this is going to work for it. So we put 2 little wires in less than an hour. And now all of a sudden it's heaven. Oh. Come on. Give me what the real scoop was. How did it make you feel?
Seriously, I don't feel that gnawing pain. And that gnawing pain, if you can imagine getting beat with a baseball bat in your lower spine, and nothing you can do to get rid of that pain. It's just, and then for this, God, to have this placed in, it's just a godsend. There is no words that can account or to put in the words to describe the relief that I get from this.
What I want to know is, so there's a number of patients who are on the fence, and they've heard a whole host of stories where they're like, hey, it's going to cause you to be paralyzed. Hey, it's going to shock you all the time, and that's the reason why I don't want to do this stimulator. Or 3, it's not going to potentially work. So for someone who really has their hesitancies and reservations about that, have you had any shocks?
No, I will say to charge the battery, I get like a little burning sensation.
Mm-hmm.
It's not horrible. It's not atrocious. I think that's about the most discomfort I get is charging it.
Okay. And so in terms of pain relief, what percentage of relief do you think you've gotten?
In my back, my lumbar, 99%. Because I'm moving better, I can work longer hours now.
What do you do?
So I'm a dispatcher for the Walkerton Police Department. They do 12-hour shifts. I couldn't even get through 6 without going home crying because it's like it's a compression feeling. The more you sit, your spine, you can just feel it. So I've been able to work 12-hour shifts. By the 9th hour, it gets a little achy. I can turn this up. It helps it. But I can get through a 12-hour shift now. My back is just wonderful.
And so for someone who's thinking about a spinal cord stimulator as a potential option, and they have a number of people who are telling them, I'm not so sure, it's not going to work, it's going to cause you more problems and issues, what would you tell them?
Do your homework. I watched those videos that the representative given me. I watched YouTube videos of actual people that were getting them or had gotten them, and they did videos on their progress. Mm-hmm. And I've talked with people that's actually had them. Don't go for those people that have heard.
All right. Thank you so much.
Thank you.